Autologous stem cell transplant for patients, family, and caregivers. An autologous stem cell transplant is a medical treatment that replaces a patient's bone marrow with their own healthy cells. Before patients start their treatment, there is certain information that is important to know and will help patients, family, and caregivers prepare. In this video, we will discuss what a stem cell is, go over a generalized timeline for an autologous stem cell transplant at Moffitt Cancer Center, and provide details on how to prepare and what to expect. So what happens with an autologous stem cell transplant? First, bone marrow and cancer cells are destroyed with high-dose chemotherapy, or what is often referred to as conditioning therapy. The patient then receives a stem cell transplant after that therapy is complete. Then we wait for these new cells to begin to grow, or what we call engraft, and create a new bone marrow in approximately, or on average, 10 to 12 days. So what is a stem cell? A stem cell is an immature blood cell that can develop into one of three types of cells we have in our body. Those cells are red blood cells, white blood cells, and platelets. After the transplant is complete, we wait for the new cells to grow and focus specifically on a type of white blood cell called a neutrophil. Neutrophils are a type of the white blood cell that help protect the body against infection. This is a generalized timeline of an autologous stem cell transplant. During the initial visit, the patient will meet with their primary blood and marrow transplant doctor and team, often referred to as BMT. After the initial visit, the blood and marrow transplant team, or the BMT team, will develop a treatment plan, which includes conditioning chemotherapy, timing for transplant, and vital organ testing. This testing can be in different departments and different locations at the cancer center, and the purpose of this testing is to make sure the patient's body is ready for the transplant. After testing is complete and patients are deemed ready to move forward with transplant, patients will have an appointment with their BMT doctor to review the test results and sign consents. Next, a central line will be placed, which will be discussed in more detail shortly. Once the central line is placed, the patient's stem cells are collected, frozen, and stored until the day of transplant. The steps discussed thus far are completed in the outpatient setting, meaning the patient will come in for the appointments and go home after. The next step is the start of conditioning therapy. This is when the patient is often admitted to the hospital. We have a numbering system that we use in transplant, and the day of admission begins on a day minus number. The number itself depends on the conditioning therapy regimen the medical team has ordered. For example, a patient may be admitted on day -5, and then we count up and finish our negative numbers prior to the transplant day, which is called day 0. The day of transplant is 0, and then we count up after that. So the next day is day +1. After the stem cell infusion, we wait for the cells to begin to grow or engraft and create that new marrow. Autologous transplant patients, on average, engraft anywhere from day +10 through day +12, at which time the patient may be able to leave the hospital and stay locally until day +30. While this is a lot of information, we will discuss this in more detail. After the initial visit, and when that vital organ testing is complete, the patient will have that central line placed. A central line is a hollow plastic tube that is placed in the chest and tunneled under the skin. It is used for collection and infusion of stem cells, chemotherapy administration, drawing blood samples, and administration of IV fluids, medication, and any transfusions as needed. The procedure to place a central line is done in the outpatient radiology department and takes approximately 45 minutes. Because this is considered a surgical procedure, patients will receive further instructions prior regarding preparation. In most cases, patients will receive light sedation, so they will need someone to drive them home after the appointment. Ice packs will help with comfort and swelling, and the medical team can let the patient know what medications can be taken for pain if needed. The line will be placed in the patient's chest, on the opposite side of the chest if the patient has a port, and will have two external tubes, or what we refer to as lumens. The nurses in the BMT treatment center will care for the line while the patient is outpatient by flushing it and changing the dressing. The dressing will need to be changed every 7 days and as needed. The dressing will have to be covered while showering to protect it from getting wet, and the nurses will show the patient how to do this prior to going home and prior to admission. The line will stay in place throughout the transplant, and the patient's BMT doctor will determine when it can be removed. Typically, the lines are removed close to day plus 30 or before returning home. After the central line is placed, patients are often scheduled for apheresis, or what is the actual stem cell collection. This procedure is done outpatient, and the patient will be connected to a specialized machine shown in the picture. This machine collects the patient's stem cells and returns the remaining blood back to the patient. Prior to this procedure, mobilization of the stem cells from the bone marrow is needed. To do this, patients will receive growth factor injections once a day for 4 days after 5 p.m. Prior to collection, we ask that patients start hydrating well and drink plenty of fluids 3 to 4 days before the actual cell collection. On the day of stem cell collection, usually on day 5, patients should arrive at the apheresis department at their scheduled time. The collection can last up to 8 hours and can range between 1 to 3 days. It is important that patients have a good breakfast the morning of the procedure and that they bring any medication that needs to be taken that day with them. Patients may bring snacks, laptop, books, phone, headphones, or iPads to pass the time if so desired. TVs, warm blankets, bedside commodes, and urinals are available. Food and beverages are also provided for patient convenience. After the procedure, the patient's cells are processed by the cell therapy laboratory at Moffitt Cancer Center. They are then frozen and stored until the day of transplant. If additional days of collection are needed, the patient will receive another growth factor injection again after 5 p.m. and will be notified by the medical team. Patients, please make sure to drink plenty of fluids and have a good dinner the evening of your procedure. Once the stem cell collection is complete, the patient's next appointment is often admission to the hospital, where he or she will begin their conditioning therapy. Each patient will have a treatment plan that is determined by their primary BMT doctor. The chemotherapy or conditioning therapy will be given anywhere from 1 to 6 days, depending on the plan. Scheduled nausea medications are given prior to the start of chemotherapy, and additional medications are available as needed. One of the chemotherapy drugs that is often used in conditioning therapy is called melphalan. The nurses have orders to bring patients ice chips to keep their mouth cold. Patients will be asked to hold the ice chips in their mouth and allow them to melt for 5 minutes before the start of the melphalan infusion, during the infusion, and for 15 minutes after the end of the infusion. The reason for doing this is that it has been shown to decrease the severity of mouth sores, a potential side effect of chemotherapy. After the days of chemotherapy are complete, the patient will have what is called a rest day. This is on day -1, where no chemotherapy is administered. Once conditioning therapy is over, it is time for transplant day, which is completed on day 0. The stem cell transplant or infusion will be completed in the patient's room. Pre-medications such as Tylenol or Benadryl are often given to prevent reactions. These reactions could be due in part to the preservative in which the cells needed to be frozen. Patients also may receive IV fluids before and or after the transplant. The length of time it takes to complete transplant depends on the number of bags patients will receive, which is often determined by cell count and processing. The nurse stays with the patient the entire time and will take multiple sets of vital signs during and after the infusion, and also be monitoring for any side effects. Patients should report any new symptoms to the nurse right away. After transplant day or after day 0, we start to count up day +1, day +2, and so on. This is when we are waiting for engraftment for those new cells to begin to grow. However, red blood cells, white blood cells, and platelet counts will begin to drop after that conditioning therapy, which is an expected side effect. After the drop, we then wait for these counts to start to rise. And when this happens, we call this engraftment. The first cells to usually return are the white blood cells, then the red blood cells, and finally platelets. However, each patient can be different. As we wait for engraftment, patients may experience the side effects of conditioning therapy and or any complication of transplantation. Common side effects of conditioning therapy may include nausea and vomiting, diarrhea, decreased appetite, mouth sores, hair loss, pain, fatigue, changes in memory and concentration, decreased blood cell counts, and possibly infection. Patients may experience one of these symptoms, several of these, or all of these. It is important that patients communicate to their nurse and medical staff about their symptoms when they occur so we can help with symptom management. Nausea and vomiting can start at the beginning of chemotherapy. There are different therapies and medications available to help treat that. If patients experience diarrhea, the medical staff need to know. If it is liquid, watery stool, we will need to obtain a sample and send it to our lab to test for infection. There are also medications to help manage this side effect. Patients can often experience decreased appetite due to nausea and vomiting, mucositis, or even taste changes. There is a dietitian available to assist with any nutritional needs. It is important to get enough nutrition and stay hydrated during this time for the body to stay strong. The medical team will monitor everything the patient eats and drinks to make sure their body is getting what it needs. We may need to give patients IV fluids to help prevent dehydration. Mucositis is the medical term for mouth sores. Patients may get sores in their mouth, on their tongue, their lips, and sometimes throat, which can often make it difficult to swallow. We have mouthwashes and rinses to use for comfort, and some people may need pain medication to help with possible pain until these sores heal. Hair loss can occur and usually occurs around day +10 to day +11. The nurses can help make arrangements at the Moffitt salon for patients to have their heads shaved if they would like. Fatigue is one of the most common side effects and can often take a while to recover from. The best thing patients can do is to stay as active as possible, taking walks, staying out of bed, working with physical therapy as scheduled will help. Patients' blood cell counts, as mentioned, will decrease as a result of conditioning therapy and is expected. This in turn will put patients at risk for infection and potential bleeding risk. Nurses will write the cell counts up on a calendar in the patient's room while they are inpatient every day, so patients, family, and caregivers are aware of these numbers. As mentioned, pain could be a potential side effect experienced during this treatment, from possible mucositis, abdominal pain, body aches, bone pain, or even potentially chronic pain. It is okay for patients to use pain medications to help control pain and keep themselves comfortable. The medical team will be managing these medications to make sure patients are not becoming addicted, and doses can be adjusted to reduce any possible side effects associated with any of these medications. The decreased blood cell counts that are unexpected side effects, like as mentioned, will be written up on the calendar every day. These counts will be the white blood cells, the red blood cells, and platelets. With the white blood cells, we are focused mainly on those neutrophils, which is a type of white blood cell that can respond to infection. When patients' absolute neutrophil count, or what we call ANC, drops below 500, patients are considered neutropenic and at high risk of infection. Red blood cells, or RBCs, are what carry oxygen to the body and are measured in hemoglobin. If the patient's hemoglobin drops below 7, the patient will require a blood transfusion, unless specified by the medical team. Some patients may require blood transfusion prior to dropping below 7. Platelets help to prevent bleeding by helping the blood clot. Bleeding risk increases when the platelet count drops below 50. It is important that patients report any signs of bleeding. For example, bloody nose or even gum bleeding. When the platelet count drops below 10, patients will need to receive a platelet transfusion. As blood cell counts drop, or more specifically, white blood cells drop, patients are at high risk of infection. It can occur anywhere in the body, and patients will receive medications to help prevent infections, such as bacterial, viral, and/or fungal infections. While in the hospital, nurses and oncology technicians will be checking the patient's temperature every 4 hours. If a patient has a temperature of 100.4 degrees Fahrenheit or higher, the nurse will start what is referred to as fever protocol. Fever protocol is a term we use to describe a list of things the medical staff will need to do when a patient has their first fever. This includes drawing blood cultures from the patient line, port, or even a possible IV stick. A chest x-ray will be done, and the patient will be asked to provide the nurse or medical staff a urine and/or stool sample to look for the potential source of infection. Sometimes there is a specific source of infection. However, there are different things happening during transplant that may cause fever. We will treat the patient as if there is a possible infection regardless, while their new immune system is still growing. These low counts, as mentioned already, will be putting the patients at high risk of infection and possibly at risk for bleeding. Both infection and bleeding infection precautions start the day of admission. Hand washing is expected of everyone. Everyone entering the blood and marrow transplant department is required to wash their hands with either soap and water or hand sanitizer. No one that is feeling sick or ill or has been exposed to anyone with contagious disease should visit. No fresh, dried flowers or live plants are allowed. And we ask that patients remove any gel or artificial nails, any piercings with the exception of earrings, and if they use contact lenses, they should bring their glasses during this time. To prevent bleeding, soft toothbrushes will be provided to the patients, and they will receive a new one every 7 days to decrease infection risk. No flossing, toothpicks, or water picks are allowed. If patients are on blood thinners, these medications will be stopped when the platelet count drops to 50. We ask patients to try to avoid blowing their nose forcefully and to use electric razors only. It is also important for patients to trim their fingernails and toenails prior to admission. Do not bring clippers to the hospital. If needed, a file and/or emery board will be provided. On admission day to the inpatient unit, patients will enter at red valet. Once entered, the admission office will be on the right, and this is where the admission paperwork will be completed. Once complete, the patient will be provided their room number and directions on where to proceed. Each patient will be admitted to either 3 West or 4 West inpatient unit. These units are laid out exactly the same. All rooms are private and have a television and internet access. Patients are required to stay on the unit and not walk past the double doors unless for a procedure or test. Patients, their family, and friends or caregivers are also not allowed to go into any other patient room for any reason. Visiting hours are open, but anyone entering the unit must be 12 years of age or older. One adult caregiver may stay overnight at any time or even stay the whole time the patient is admitted. There is a pull-out bed and linens available. Visitors are not allowed to use the patient's toilet, but may use the shower and sink. There are 2 separate restrooms on each floor in the hallways and a family lounge with a restroom and shower at the front of each unit for visitors to use. Most importantly, please remember no sick visitors are allowed. We want our patients to be as comfortable as possible during their treatment. It is not required to wear a hospital gown during the inpatient stay. However, they are available if needed. Patients can wear whatever they are most comfortable in. Feet must be covered at all time when out of the bed. We recommend shoes with good traction, and slipper socks can also be provided. If patients experience hair loss, it is often good to bring hats or scarves. Patients can bring their own personal care supplies, however, these can also be provided. Patients may also want to bring their own pillow, blanket, or comforter, and this can be brought in for comfort. However, please make sure they have been cleaned or are new upon admission. If hearing aids or eyeglasses are used, the patient should make sure they bring these in also. Pictures are welcome, just no glass frames, please. Patients may also want to consider bringing small crafts, hobbies, laptop, or books for things to do. Other items that may be helpful during this time to have are the Patient and Caregiver Transplant Guide, provided by Moffitt Cancer Center, a copy of any advance directives, such as a living will or healthcare surrogate designation, any diabetic supplies or personal medical equipment that may be needed when discharged from the hospital while staying locally. Since patients are not allowed to leave the inpatient unit or those double doors once admitted, caregivers would need to do laundry if necessary. There is a washer and dryer located on the 5th floor for patient and caregiver use. Patients are encouraged to bring many changes of clothing for their hospital stay. However, hospital gowns are available. During the inpatient stay and at discharge, it is important that patients practice food safety to decrease infection risk. Patients should not eat sushi, raw meat, or raw fish. Patients can order anything from the hospital menu. The hospital food service staff knows how to prepare their food. Food can be brought in from home by family or caregivers, and there are refrigerators on each unit. However, before placing food in the refrigerators, a patient label and date is required and is available. Refrigerated food can only be stored for 2 days in these refrigerators in the pantry. And once the food container has been brought into the patient's room, it cannot be put back into the refrigerator. Food from restaurants is allowed if it is picked up by a family member or caregiver and brought directly to the hospital. No delivery is allowed. During the patient's inpatient stay, The BMT, or the blood and marrow transplant team, is working hard to plan the patient's care and address any needs and concerns. There are numerous members of the inpatient BMT team, and patients should meet all the team members soon after admission. Daily BMT rounds are done as a team to ensure all services are collaborating on the plan of care for the patient. This team consists of a BMT physician, which rotates or changes every 2 weeks, a potential fellow, an advanced practice provider, such as a nurse practitioner or physician assistant, registered nurse, social worker, dietitian, case manager, pharmacist, and a physical therapist. This is a generalized routine while the patient is in the inpatient unit. Nursing staff will draw blood every morning and weigh the patient. Weekly rectal swabs will be performed to test for potential bacteria. Nursing assessments and vital signs are completed every 4 hours, and staff may need to take additional vital signs such as orthostatic vital signs. Staff will also check in on the patient hourly and make sure they are doing okay and measure any intake or output. As part of the day, physical therapy may visit and work with the patient. Medication, IV fluids, and transfusions will be administered as ordered or needed. And patients will need to perform personal hygiene. The 3 biggest things for our patients to focus on during this treatment is eat, drink, and walk. These 3 things may seem simple, but are the keys to success during transplant and should be a daily focus. As mentioned, personal hygiene is an important part of the daily routine. Patients will be provided CHG or HIPAA when they are admitted. This is a medication for the skin that helps prevent infection. Either the CHG soap provided or the wipes must be used daily, unless, of course, the patient is sensitive to the products. CHG soap is applied directly to the skin and rinsed in the shower. CHG wipes, on the other hand, can be used in place of showering and do not require rinsing. These products, CHG, should not be used on the face. Another form of personal hygiene and important part of infection prevention is mouth care. The mouth contains many kinds of bacteria, so performing mouth care such as brushing your teeth, cleaning dentures or partials, using oral rinses will help keep the mouth clean and moist. Patients will be provided soft toothbrushes, alcohol-free mouthwash, toothpaste, and petroleum-free lip and mouth moisturizer. Patients should be brushing their teeth 4 times a day, after meals and at bedtime, and after any potential vomiting. If patients are experiencing vomiting, mouth sores, or are currently not taking anything by mouth, this schedule may need to change and/or increase. The nurse will help the patient determine what is best. As mentioned prior, during the daily routine, patients will have their vital signs taken every 4 hours. However, at times, there may be additional vital signs needed, called orthostatic vital signs. These help determine if the patient is experiencing orthostatic hypotension, which occurs when there is a significant drop in blood pressure and then an increase in pulse with position changes. If the patient is found to be orthostatic hypotensive, they are at great risk of getting dizzy, passing out, and/or falling. Patients should always report to the nurse if they are feeling dizzy or lightheaded. If the patient is found to be orthostatic hypotensive or positive, staff will encourage the patient to drink more fluids. The patient may need to receive IV fluids, and the medical team will evaluate patient's medication to determine if that could be increasing this risk. Fall precautions will also need to be put into place if orthostatic hypotension is determined. Orthostatic hypotension is only one of several reasons patients could be at risk of falling when they are in a hospital. Falls can occur in any age group, at any time, and any place. Falls can also be caused by side effects of treatment, medication, weakness, fatigue, dehydration, and even decreased blood counts. If the patient is at a high risk of falling, we will take extra measures to prevent the patient from falling. When fall precautions are put into place, a bed and/or chair alarm will be turned on. Patients will be asked to get out of bed or chair only with staff present. Staff will stay with the patient's side in the bathroom where most falls commonly occur for patient safety. Although these precautions may be put into place, this should not stop the patient from walking in the hall and getting out of bed with staff assistance. They need to remain active. It is important patients partner with the medical team to keep them safe by calling for assistance, wearing closed-toed shoes, wearing hearing aids and glasses if needed, using any recommended assistive devices such as walkers, and by storing personal items within reach. Once the patient has engrafted, meaning that absolute neutrophil count is greater than 500, they may be able to be discharged from the hospital to local lodging. To be discharged from the hospital, the patient must have not had a fever in the last 24 hours. They need to be able to eat and drink, swallow oral medications, and if any IV medication or fluids are needed, they need to be able to be managed in the outpatient treatment center. Patients are required to have a caregiver with them when they are discharged from the hospital, 24 hours a day, 7 days a week. Both patients and caregivers must have attended the BMT discharge education class, and housing arrangements for local lodging must be in place. The BMT discharge education class is provided virtually over Zoom every Wednesday and Saturday at 3 p.m. Eastern Standard Time. Once the patient is discharged, please expect frequent visits to the BMT clinic and treatment center. This is where the patient's primary BMT doctor and medical staff will continue to monitor them until day plus 30 or when they feel it is okay for the patient to go home. During this time, readmission to the hospital may be necessary if the medical team wants to monitor the patient more closely. Prior to returning home, the central line will be removed. Thank you for watching our video today on stem cell transplant at Moffitt Cancer Center. This video is not a substitute for required scheduled classes for patient and/or caregivers. This content is not intended to be medical advice, and the viewers should consult their physician should they have any questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs. If you think you may have a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because of information contained in this presentation.